part of the small intestine. Let's see. Carla, could you name the 3 parts of the small intestine for me? Did you cover that with Mr. Donahue?
Yes.
Sorry to put you on the spot.
Mm-hmm.
Fine, just name 1 part that's not the ileum. So we already have ileum, we've got 2 other parts.
Like the
That's large.
Yeah, that's it. That's it.
What about small?
You know something?
Here's a hint, they all end in
It's duodenum.
Jejunum.
Jejunum.
Duodenum, right, good, duodenum. Very good. Let's see, who else haven't I really heard from today?
Reagan?
Reagan, yes. Reagan, so small intestine. We have duodenum, we have something, and then we have ileum.
She's been asleep.
What is
the
the
whole
middle
time.
part of that small intestine?
Yeah, but like.
Jejunum, very
She
good.
was not helping the group during the and she's.
So yeah, terminal
but
ileum,
like,
right, the very end of the ileum.
You know,
Or the
help
proximal colon,
yourself.
start
You know,
of the large intestine.
like if you know you're
Once again,
struggling,
parentheses appears as these
do something
large
about it.
distended loops of
Study.
air in the small intestine, right? Because that air is kind of backed up. And so the air in the small intestine.
we don't call these digits anymore. You know? You should know the terms.
Hey, next up, intussusception. All right, so since you volunteered, Charles, go ahead and say that a bit louder. Say that a bit louder. What is that? I saw a nice hand motion as well.
It goes in on itself.
Good, it goes in on itself. It telescopes in on itself. Right, so you've got a tube, right, and then like pushes in on itself. It folds in on itself. So this is the telescoping of a section of bowel into another loop of the bowel. Right, so it folds inside itself. This is most common in the terminal ileum, once again, so near the end of the small intestine. This is most common in children. And this requires rapid treatment. They must be treated within 48 hours, or necrosis may begin. Johns, what do we mean by necrosis?
That's a very good question.
Thank you.
Can I get it in a sentence?
Necrosis. So
Requires
if intussusception
treatment.
requires treatment within 48 hours, or else there will be necrosis of the tissue.
The twisting apart itself?
Twisting apart.
For necrosis?
Let's see, necro. Have you seen the word necro before?
Yes, that.
That?
Yes, necro means death. So necrosis of the tissue, what do you think that is?
That taste like that tissue?
Yes, death of the tissue, very good. So necrosis of the tissue begins to die. Right? That is definitely not ideal, so it does require treatment. Okay, once again, because we do have air being trapped, you see the air here, right? So extra air, decreased exposure techniques. Some more examples of intussusception. Okay. So over here, we can kind of see that folding of the bowel into itself. And then on this side, why do I have this one? I think on this one I actually wanted to ask, if you look at this image here, what position was the patient in? Is this upright? Is this supine? Is this prone? Is this a decubitus?
Decubitus.
Standing.
I
Upright.
think it's upright, but they spread themselves and they're leaning against the floor.
Okay, so since I think Shamika was one of the first to answer, why do you think it's standing or upright?
I think it's standing because I see the diaphragm. So I'm thinking of a KUB in that sense of.
It also says AP
Yeah, I
standing.
see, that's why I said standing right there.
Yeah.
And
All
also
right,
you see-
good.
And also you see the
Right.
airs are on the top.
Okay, good. So there are two main ways you can identify this. Number one is the marker right down here,
Yeah, that's why I was like, right?
AP stand. Okay, so easy, right? But the second way you can identify it,
Spine.
if you look at the air here, what do you notice about this air bubble?
It's a gastric bubble.
What do you notice about the shape of this bubble?
Circle.
So what does the top look like? Round.
It's
What does the
half a
bottom look
circle.
like?
Oh, the fluid.
Air fluid level.
Oh, okay.
So that is your air fluid level. You look at this bubble, same thing, right? So that is one of the signs you can use to determine if it is standing versus supine.
Where is the interception there?
Where is the interception?
Is it more lumbar?
It is, I think it is this sign right here. This kind of like ring donut looking thing.
Okay.
Where?
So do you see this kind of circular ring right there? Hold on, let me turn off the lights here. Which one is it? This one?
Yeah, no.
No. Sorry.
Oh, that's better.
So, do you see the ring-looking donut thing right here?
Yeah, that's pretty big.
So I believe that's the interception sign.
Is that multiple or is it just like one?
It's
It's just a
same-
big one, you need to go.
Wow.
Inside.
Boom, boom.
And the final example of dynamic bowel obstruction here is volvulus. So volvulus is just intestine, right? A twisting of the loop. Okay. So once again, this may require surgery for correction. The way this appears is that you get a large amount of air in the sigmoid. And when you get a large amount of air in the sigmoid, you end up with these two kind of unique looking structures. If the patient has contrast, you end up with a bird beak sign. So, do you see how the contrast is coming up here through the rectum? It's coming up here into the sigmoid. It's coming up here, and suddenly, you see this point here? Right, so this is like the head of the bird, that's the beak. Do you see that? It tapers off. The second thing you can look for is the coffee bean sign. So if you take a look at the air this time, not the contrast, but the air, do you see how the air is like right here? And you see this like kind of like thing here in the middle? It looks like a coffee bean. Do you see that? Or maybe like a walnut or something?
Coffee.
Right?
Maybe a walnut because you have that nuts inside.
Okay. So,
Can you go back?
sure.
Thank you.
So this is your coffee bean sign, and this is your bird beak sign.
So what's the difference
So interception is folding in on itself like this. Volvulus is a twisting. So let's take a look at some other images here. So over here, we kind of have our coffee bean sign. This one's not as clear, but you can kind of see that. And then on this side, you have
The bird beak
that
sign.
bird beak, right? Once again, that tapering off of the sigmoid.
So it's like that beetle that has the horn.
Beetle horns?
Dung beetle?
Like the, like one
Hmm.
Oh, it looks
Or
like
like half of the beetle?
Oh, the rhino beetle.
The rhino
right?
beetle.
Yeah, yeah, yeah.
Okay, I see.
Yeah.
the rhino looking one, yeah.
Yeah, you know what I'm saying? Yeah.
Ah, okay. Hmm.
Yeah, cause I don't see a bird beak, but I see.
I see an eagle.
Okay.
Yeah.
Well, I guess whoever whoever first discovered this was more into birds than bugs.
Yeah, it looks more
Man,
like
I
a
see a
beetle.
crab leg. I'm
If it was the
hungry.
other way, then maybe
I see a crab leg. I'm hungry.
That's a lobster.
This
That's
one
a-
looks like an
Yeah.
that's a
elephant.
claw.
sign, okay.
So this one looks like an elephant and that one looks like an eagle. Look at the trunk going down.
Oh, I see.
Well, right. Just goes to show that it's important to be the person who discovers it first, so you get to name it. Right? You get to name it whatever you'd like. Now, we have non-mechanical bowel obstruction. So in this case, it's not something that's physically blocking the bowel. Instead, it's just that the intestine does not push things through. Right? So we lose that peristalsis, and we get what's called adynamic ileus or paralytic ileus. Right? So the intestine is kind of like paralyzed, it isn't going to push things through. Why does this happen? Well, this most often happens after surgery. It happens after post-op, after anesthesia, after surgery. Takes some time for the patient to recover.
Oh, that must be why they gave you laxative.
Why do you give you the laxative like before surgery?
No, it's after.
Or after surgery?
I think we can't.
To try and get.
Yeah, we try
Is
to
that
make
why
sure.
the nurses always come in and ask you, like, oh, do you use the restroom or try to use the restroom?
Yeah.
Or
They
if
come
you
and
want a
check.
straw?
Once you make
That
that
may
first
be.
bowel movement, they're okay.
Well,
So
like I
they
got
give you a
epidural
laxative.
and then I guess it slowed down my whole system after pregnancy, after birth. And so I got laxative fluid and
Oh, okay.
Mm-hmm.
And they make you blow on a straw too.
They make you blow on a straw.
So you can use the restroom, cause you'll feel like you don't need to, but then you really do, so.
Is that because
To
it
increase
forces
the
your?
pressure.
Yeah.
Is that because it forces your like abs or?
Right, so I think it increases your intraperitoneal pressure, and so it activates the muscles involved in that.
Okay.
So this appears as large amounts of air in the dilated intestines and with air fluid levels visible. Here, this one, so this one looks like it was done supine. And the reason I'm saying that this is most likely supine is because I can see the patient needs to use the restroom. And this is circular, right? I don't see any flattening, any fluid levels. So most likely supine, I can see their bladder.
I thought that was contrast.
No, that's most likely just bladder. That's just urine sitting
And
in
the
the bladder.
boundary
Yes.
sideways, that doesn't give any hint, sir.
What is that?
The marker
No,
sideways.
so marker sideways, it makes you think, oh, this could be a decubitus, right? But if that was true, the fluid would look like this.
Even if they like didn't necessarily have to go that bad.
Even if they didn't have to go, right, the fluid will still settle. Right? It will still settle in the correct location. It will fall downwards due to gravity. Right? But if you take a look up here, you can see that air-filled bowel, right? Lots of air has collected inside here. Once again, lots of air, so decreased exposure. Reduce our KBP or our mass. Usually, we're just going to be decreasing our mass. A few more pictures.
So ileus always looks like spider webs, or I guess it's-
I'm not going to say it always looks like spider webs, but it's just that the bowel is going to be super distended.
Okay.
I see a ton of
Smoke
air.
would be better, yeah.
So is that the same as the heart and
What do you mean?
the
So duodenum, jejunum, ileum, that is going to be your small intestine. So, yes, you would see the small intestine kind of swollen over here. Here you can also see that this large intestine right here, the descending colon, transverse, also has quite a bit of air in it as well.
So would your stomach be hard to detect, like hard to detect, like with all that air?
It's not going to be as hard as something like ascites. And then finally, we have ulcerative colitis. So, ulcer, right, we've got a wound inside the colon. And so this means that if we give the patient contrast, that contrast can leak through the wound into the rest of the body. This means barium enemas are contraindicated. Sindhu, what do we mean by contraindicated?
Opposite reaction?
Opposite reaction. Opposite because contra? Or why do you, why do you think opposite reaction?
I don't know.
Not sure? Okay. Let's see. Cody, what does contraindicated mean? Any guesses?
Like the contrast is indicated on the.
Okay, so that's a good point. Let's take a look at it from the other point of view then. What would it mean that something is indicated?
It's shown sign.
Right, so let's say that there's a pathology and it's like, okay, we can't see this unless we have contrast. So contrast is indicated. We need to use contrast to see this. Contra, what does that mean?
Against.
Against. So, contraindicated means you should not use this.
Because of nutrient.
Correct. So, because of leakage, the possibility of barium going into the rest of the body, the barium enema is contraindicated. You can't use barium in the colon here. Or, for example, if someone has an allergic reaction to a medicine, then that medicine is contraindicated. You cannot use the medicine of the patient because they will have an allergic reaction. So you will hear in the hospital people talk about contraindications. This is contraindicated, that is contraindicated. When you hear that word, that means do not do what is about to follow the word contraindicated, or what came right before contraindicated. Right, so barium is contraindicated. Okay, I won't use barium. Or penicillin is contraindicated. Okay, we can't give this person penicillin. So, ulcerative colitis occurs primarily in adults, usually in the rectosigmoid region. Okay, so somewhere down here. Okay, this is a type of inflammatory bowel disease, which is why it has the itis, or inflammation. And this could lead to toxic megacolon, which is the extreme dilation, extreme growth in size, or the stretching of that colon. Right, so, first of all, this does tell you that our colon is going to be dilated. It's going to stretch out. And when it stretches out, you will see, or you may see, something called thumb printing. So if you think about your thumb, right? Your thumb has ridges from the thumbprint, right, or your fingerprint. If you take a look at the edge of this colon here, do you see that right there?
Yeah.
Yes.
Right? The folds of the colon. Right? So it makes it look like the edges of a thumbprint or the edges of a fingerprint. So the colon has dilated, has stretched out so much that even the loops of the colon are visible individually. Okay, so that's what we need. So this is a sign of ulcerative colitis.
You're talking about those little like poke, those spike things.
Right, these little spike things right there. Okay. Yes. Natalie?
Like what it looks like? Like are you gonna give us an image and say what is this?
Okay, so on the exam, I may do something like give you this image, and then I may have a circle here, and I may say the thumbprinting seen in the circled area indicates what kind of pathology. So you may be able to use the image, you may be able to use the text, right? All of it gives you context as to what this is supposed to be.
But is it gonna be like an image and text on it, or you're just gonna go to the image?
So usually I will give you image and text. The only something super obvious would I only give you an image. So something super obvious, probably the only super obvious thing that I can think of,
The apple.
to be honest. Right, so apple core, right? So apple core, yes.
And the
Ascites?
Legal.
Or bird beak, maybe, I'm still kind of
Or
on
what?
the fence about that.
Ascites?
Ascites is a bit tough, right, because it's just kind of a general whitening of the abdomen. So it's hard for me to say, okay, what is this? Is it ascites or is it something else?
Fibrous
The bird
adhesions?
beak, it has to be like really like beaky.
A bird beak.
Yeah, beaky in order for us
Right,
to.
yeah, no, so, right, normally on a bird beak, I would circle it and ask you what it's supposed to be. Sorry, whoops, where am I? That's my folder again.
Just open the
Alright,
case.
there, that's the chart.
Yeah.
Okay, or,
You're recording, right?
right, something like this, right? Something like this should be obvious. Because just looking at this, you can clearly see there's a difference. And at that point, you should be asking yourself, okay, what exactly is the difference? I've got white here, I've got black here. Why is this all black? Because pneumothorax. So, something like this that's super, super obvious, I might just give you as a picture, but everything else, I'll try and give you some context to it. So you can use the words, the context, and the image together to try and answer the question.
Does that mean that only image we get is the pneumothorax?
No.
So that's how you're putting it. So.
No.
Jacqueline, don't say it. He's gonna change his mind.
Thanks.
Just keep it in your mind.
So PRE is going to be Monday, and then this one will be on Wednesday. Because Monday we'll spend time to review for this exam.
It's gonna be a test week.
Yeah.
Okay.
And Friday is Mr.
So yes.
Oh, no.
No.
Monday is PRE, and then Wednesday is pathology.
And then following Mondays.
Any questions over what
Just
we
one less
discussed?
test.
Oh my.
We're okay with abdominal pathology?
Yes.
Not that bad? So if I ask you, like, for example, which of these is not dynamic bowel obstruction and fibrous, Crohn's, interstitial subsumption, and ileus?
Ileus.
Right, you know that ileus is non-mechanical, right? Okay, very good. Great. So let's take a break, and please be back by 1:37. Take a break, please be back by 1:37.
Where's the gym here?
You wanna go?
I know city the park.
I couldn't find it.
Gym
You
is
remember
basement
how to do it?
through the double